Good afternoon. I'd like to thank the organizers of AICC RCOG 2021 for inviting me to talk on a subject that's so close to my heart. Working together for the woman in labor. I thought this was such an appropriate topic. And over the next few minutes, I hope I will be able to convince you about the need for working together. How do you and I, as obstetricians, look at labor and birth? Helen Shallow, a senior midwife, says, labor is what a woman says it is. She owns it. Do we believe that? Have we accepted that reality? Do we look at labor and birth as a normal physiological event or a catastrophe waiting to happen? Have you and I ever enjoyed watching or supporting a woman in what we would call a birth without any interventions? No IV lines, nothing. Sets into labor spontaneously, enjoys her whole labor and birth by walking around, eating and drinking, being supported by the people she wants in that room, privacy, quiet, and then is able to hold her baby immediately after the baby is born, and the placenta births itself. That's a true physiological birth. And you and I, I'm afraid, have lost that capacity to wonder and enjoy it. Are we open to women seeking birth plans that challenge our beliefs? Is the woman and her baby at the center of decisions that we make? So, in other words, are we prepared to change our childbirth practices despite the overwhelming evidence that we have and that's been growing over the years? Some of us still continue to practice in methods that have no scientific basis. The whole world today is screaming for midwives, and we know that countries that have invested in midwifery and midwifery care as the backbone of their maternal health services have reduced maternal mortality, morbidity, and infant mortality and morbidity. Maria Mongan, founder of hypnobirthing, said, when you change the way you view birth, the way you birth will change. And I must admit, my 10-year journey with midwifery has made me look at birth very differently. There's been a complete radical change in my understanding of birth and the way I would like to support women as an obstetrician. For a woman's perspective on labor, it's a roller coaster journey. Those of you in the audience who have had, your own experiences of labor and birth, I'm sure will remember every detail surrounding that whole experience. Why are we focusing on labor today? We know that pregnancy, birth, and the postpartum period are very significant events in a woman's life, in her journey to motherhood. Her labor and birth experience will affect her profoundly and may, if she has been traumatized because of the experience during labor and birth, it scars her for the rest of her life. And that is why it's so important we focus on making that birthing experience, the labor and birth, a positive, uplifting experience for every woman. What matters to women during childbirth? A systematic qualitative review done by Sue Down et al. Points towards not just a healthy baby, a clinical and psychologically safe environment, but emotional support from both companion and competent kind clinical staff. The WHO, in its intrapartum guidelines in 2018, says keep things natural, support women, let them be involved in decision making, and finally, they experience a sense of achievement. If during labor they are supported, they are heard, they are listened to, even if she does end up with a C-section, she still looks back and thinks it was a good experience. So, how can we work together? And who do we involve when we look after a woman in labor? I would begin with antenatal education. All our childbirth educators and teachers of yoga, hypnobirthing play such a vital role in preparing women for labor and birth. A birth companion, be it a doula, be it a midwife, be it a birth partner, so very important. Midwives, obstetricians, anesthetists, neonatologists, yes, we all play a part. And if it's a woman with complex needs, her pregnancy is complicated, we then would want other specialties and other departments involved. So, let's look at a woman in labor. Broadly, she would fall into any of these three categories. Majority of our women being healthy would certainly, and if supported and encouraged by us, left alone to set into labor spontaneously, would be best taken care of by a midwife trained to global standards. Very, very rarely would we be involved in her care. Now let's look at a pregnancy with complex needs. These women would need collaborative care, while the midwife may be her primary carer and support her during labor, but the obstetrician and probably an endocrinologist will also be involved in her care. Now, if a woman is in labor induced, well, that's a whole different ball game because sometimes it could stretch for over 48 hours. The woman's morale is low and she needs a lot of emotional, psychological support. Whatever be the category, I am convinced that these 5 basic requisites in the checklist would apply to all of these women. Let's start with knowledge. Antenatal education, childbirth preparation is so important. We've now discovered in the last 10 years, as our need for childbirth classes has grown, and we do it in languages that people understand, Hindi and Telugu, you are reducing fear. You're involving the partner. He or she knows what their role is, and you're reducing the risk of her having a C-section. This is a childbirth class in an area hospital, in a district hospital in Telangana, being done by one of our midwives. Does antenatal classes really help women? Yes. This was a systematic review in 2015, and they concluded nulliparous women, especially, are significantly more likely to have normal births if they have attended childbirth education classes. What about a birth companion? The evidence is absolutely there for us, staring in our faces. And yet, majority of women today, all across our country, be it public, be it private, birth alone among strangers. And this to me is really, really a tragedy. When a woman has continuous support during labor by a person she trusts, she's more likely to have a shorter labor, a vaginal birth, reduced risk of C-sections, and at the end of it, she finds that whole experience has been a positive, enriching one. This is a picture of a woman in a district hospital in Telangana enjoying the companionship of her husband. What about evidence-based practices? I start with something extremely simple. Staying upright and mobile. It breaks my heart when I walk into large teaching hospitals in our country today and find women lying on the flat of their backs, confined to the bed, writhing in pain, and while they are in labor. If only we could get them off the beds and get them to stay upright, to sway from side to side, hold on to a rope and sway, because upright positions, obviously, gravity helps in the descent of the head. And other positions help when a woman has a baby in an occipito-posterior position. We also know that upright and being mobile reduces the length of labor. These are simple exercises that women can do. And please note, we obstetricians are hopeless in supporting women with this because this takes time, patience, and you have to be with her for hours. That's why midwives play a huge role. Non-medicated pain relieving comfort measures. All these that you see in the list are freely available in our country. At Fernandez, we do use massage, aromatherapy, hypnobirthing, breathing techniques. What's the evidence on non-pharmacological approach to pain management? Women using any of these options have less intervention and report a higher satisfaction with their labor and birth experience. Immersion in water. Those of us who have the privilege of offering this facility for women grab it with both hands and indulge in it. You will find a huge difference in the way women go through their labor and the efficacy of uterine contractions improving. Checklist number 4, midwifery care. The heart of midwifery rests on a very simple fact. Midwives believe that birth is a normal physiological event, and they also believe that a woman has a complete ability to give birth naturally. Midwives are trained to global standards, competent, and support healthy women without complex needs. What's the impact of physiological birth, and why is it that midwives promote it? As you can see on this slide, it has far-reaching effects, the most important being maternal-infant bonding, and this prepares a woman and establishes her on a very positive note to motherhood. Collaborative care checklist number 5, and this is so important when we handle women with complex needs. Could be a diabetic, hypertensive, or collagen disorders. This is one of my favorite pictures. It shows a group of our obstetricians, midwives, and a doula in the center, all working together in an obstetric unit. Collaborative care at Fernandez also involves 2 dedicated clinics that we set up 2 years ago, led essentially by our midwives, but obstetricians involved in the care pathway. So women previous section who want to VBAC are sent to this clinic where they are followed up and encouraged and supported with their birth plans. We've also had women with a previous cesarean enjoying a VBAC in water and had a successful water birth. This would not have been possible without collaborative care. We now have dedicated breech clinics where women, when at 32 weeks there's a breech found, she's sent to the clinic. She's offered exercises by physiotherapists and midwives, and if it doesn't turn, there's ECV, and again ECV not successful, women are offered the choice of a vaginal breech birth at term. And this is a physiological breech birth with women in an all-fours position. I'd like to conclude that all of us, whoever we are at whatever level, we should understand and support normal physiology whenever we can. And my appeal to you in this audience is that, I hope you will open your hearts and your birthing rooms to midwives and midwifery care. It's only when we all work together as colleagues with mutual trust and respect, we will be able to give every pregnant woman a positive labor and birth experience. Because if we get birth right, we get everything else right. If we change the beginning of the story, we then change the entire story. Thank you.